no dangers. Patient is conscious and alert, seated on a chair, a little bit anxious, talking to the gym instructor, slightly flushed and sweaty.
Yeah,
I'm the gym instructor, so I'm
walking up
used
to
to
my
it.
patient, introducing myself. I've asked her what her name is.
Do so. Do it as if you would. Don't tell me what you know, but do it.
Alright, hi, I'm Morelle. This is my partner Cassie. So we're from the ambulances. Can you tell me what your name is?
Svetlana.
Svetlana. So I've got a response, so I can assume that airway, breathing and circulation is there. Is there any major hemorrhage?
No.
Okay. So how old are you, Svetlana?
I'm 8. Oh, it's alright. A lot of people have trouble with my name. I'm 18.
Alright, perfect. And can you tell us why you called us here today?
Yeah, well, I was working out at the gym and I just became more short of breath than normal, and I was a little bit worried. It didn't seem to want to go away, and so I thought I'd better call the ambulance because I'd forgotten my puffer. Well, I haven't forgotten it. I mean, I use a puffer.
Yeah.
And I left it at home because I don't normally need it at the gym.
Okay. So why did you have your puffer? Do you have a history of asthma?
I do, yeah. And I carry it with me, but usually at the gym I'm okay, but today, I don't know, something's a bit different and I'm just feeling, I can't quite catch my breath.
Okay.
Yeah, just a little bit frightened.
Have you felt like this before? Does this feel like one of your asthma attacks?
Yeah, it does. Yep.
Yeah, but you haven't taken your Ventolin at all?
Well, I haven't got it on me, that's the whole problem, that's why I called you.
Okay. When you've had these asthma attacks, what has happened? Have they been severe? Have you had to go to hospital and been admitted with it?
No, I've been nebulized, that's what it calls, isn't it?
Yeah, that's the one.
Taken to hospital, but I usually go home afterwards, once it settles down and everything's good and they give me a prescription and off I go.
Yeah, so why I'm looking at Svetlana, what's her position like?
Sitting quite in the chair, is coming across as a little bit anxious, judging by her speech.
Yeah.
But not using any accessory muscles.
Yeah. And what does her skin look like?
It's pink, warm, and slightly sweaty.
Yeah, so as a ventilator, I've also taken a respirate.
Oh, have you?
Fantastic.
Okay, over how many seconds?
I did it over 30 seconds.
13.
So respirate 30. I did it over 30 seconds and you said it was 15, yeah?
13.
13, sorry. Turns out like that.
Oh, I found it.
Alright. So 26. Not at all, I didn't have to give drugs. Yeah, okay, so what I'm actually going to do is I'm just going to listen to your chest. So if I can just get you to lean forward as much as you can and give you a bit of a cough. And just breathe normally.
Okay, I can do that. You've got ear to the base fields and you've got some fine wedges just in the bases.
Okay. So I've got the rate. What's the rhythm?
Regular.
Yeah. And effort, you said there was no use of
muscles,
no. Like that. So I'm just going to ask you a few silly questions. Can you tell me what day it is?
Tuesday.
Tuesday, yeah. And what month are we in?
October.
And the year?
2014.
And can you tell me where we are at the moment?
We're at the gym.
Yeah. Just need to hold your wrist here for a second. So taking a pulse over 30 seconds. Okay.
45.
I'm just going to take your blood pressure. Have you ever had your blood pressure? Cassie, can I get you to put on the monitor O2 sats to a BSL at 10 for me? Sure. Do we have blood pressure?
Blood pressure is 112 on 63.
I've already checked your skin before. I think we clip on.
Yeah, I'm not sure what those ones.
So what did you say your blood pressure? Oh no, they're the other ones.
112 on 73, it should be on the monitor. So,
Okay. So based on my PSA and RSA, she's adequately diffused and she's in a mild respiratory distress because of her rest rate and the wheezes in her chest. So I'm going to treat with 10 milligrams of salbutamol nebulized, and then I'll reassess. Cassie, can I get you to get out the next
That's the 97%.
97.
look at that, 99 and 1.
Okay, they are 99.
Okay. Sometimes when I was here, the other one
Yeah. I should also ask, do we have the spacer, if that's an option to use?
have a look in the bag.
We don't.
Okay, so we'll just use, we'll just nebulize it.
Are you sure? Not relying on pockets.
I don't think we're doing that.
I really don't think that would be
You're
okay.
doing this morning, and the other room. So
We
some
might have
days
one
you
in
have
one.
those.
Do the plastic spaces?
Well, it might be
No,
in the
no,
medical bag, do you? You have like flat cover.
Okay, you haven't got one, so go down the middle. Okay, that's fine.
So because it's through the next mask, we need to have a this oxygen going through it. So I've got 10 milligrams of salbutamol here, 5 and 5 goes to 2.5. Expiry date is March 2015. March 2015. I'm just going to check those for me.
Salbutamol, 5 milligrams, 2.5 mil, expired 2019. Good. So 10 milligrams all up. Do you want me to? I'll continue with my other duties.
So just while I'm doing this, can you give me an idea of, if I was to take away the shortness of breath, would there be anything else that you're experiencing at the moment?
No, just this. I was just, I haven't got look up. I was just a little bit worried that if it got too bad, I wouldn't be able to finish my workout. I really want to finish my workout.
Okay.
If I take a BGL,
4.5.
okay, BGL is 4.5.
Can you tell me if you have any allergies at all?
No, none.
Do you want any medication?
Just for my asthma.
What temperature is that? It doesn't it?
Temperature 36.5.
Have you been feeling well over the past couple of days?
Yep, no, I've been good. I'm keeping well, I'm working out hard, I'm training for the Boston Marathon.
Oh, brilliant.
Mm.
So are you doing some cross training today or just more
Yeah, I'm
running?
using the skipper, but I've increased my resistance and
Okay.
my thighs are really burning.
Yeah.
Mm.
Okay, that might be a little bit uncomfortable on your face, but hopefully that'll make you feel better.
Thank you.
So this was more an intense workout than normal?
Yeah.
Yeah, so you were working out and that's when you started to feel the shortness of breath.
Yeah, just
so
more
you
short, I mean, you're normally short of breath when I'm exercising, this just seems to be
yeah,
a
and
little
this
bit
is starting to
more.
feel more like you need
Yeah.
the right now.
Yeah.
Okay.
So I was a bit worried because I haven't got my hair.
And besides the asthma, do you have any other past medical history that I should know about?
No, just my asthma.
And then when was the last time you ate or drank?
12 o'clock lunchtime.
Alright, so as I'm doing this, I will allow that to some time to work, and then I'm going to reassess my patient, going back through my RSA. Has her physician or appearance changed at all? Is she looking less anxious or?
Yeah, she's a little less anxious now because she's finally getting the treatment she wanted, so that's great.
Yeah.
Not the, but I mean, she just wanted the puffer.
Yeah.
And so her anxiety was more about fully worrying she didn't have a puffer than getting hypoxia, so that's okay. So she's not sweating as much now because she stopped exercising, so her skin's starting to dry, but she's good colour. Her respirate appears to be a little bit slower, so we'll check that and monitor as her heart rate slightly up.
Alright. Yeah, so if I take her rest rate now, how much does it come down? If I'm taking a pulse as well at the same time, and then 30 seconds pulse, 30 seconds to...
So 11 for the respiration rate of 30 seconds, and heart rate approximately 50.
And when she's talking to me, I've got you on before, she's talking to me in sentences. Yeah, and now she's talking in
very honest with you. Yeah, talking very clearly.
Yeah.
Not too much.
And I'm going to re-listen to her chest. So again, just the same thing. So can I get you to lean forward and give me a cough and just breathe normally? What do I do?
You're in clear chest, wheezing just about all gone.
Yeah.
Very, very faint.
And the breaking down the rhythm. Is it regular? Yeah. Still no use of any excessive noises or anything like that. So her chest is no sign of squeezing or anything like that. That's clear.
It's lying in working out.
So I don't need to give her any more of that.
I think the team has finished.
We'll take that off now. Just to make sure that I've got a clear idea of everything that's going on, I'm also going to recheck her blood pressure as well.
No change.
Her GCS hasn't noticeably declined or anything like that.
I'm feeling much better now. I can go back to my workout.
Well, at this stage, you have actually called the ambulance, and we have actually treated you for asthma. And just as this is something that you struggle with, we would like to run you up to hospital just to get it checked out, just in case you have another attack and you don't have your puffer on you. What would you say to that?
Do I really have to?
We would like you to, yes.
Can I go to my doctor instead?
Yeah, you
If
can
I
probably
work out,
do
you
that
know,
because
so
you're fine at the moment. I just prefer if you didn't go back to your workout, but yeah, as long as you promise that you won't go back to your workout unless you have your puffer with you, then yes.
Okay.
I don't know.
You could say, let me ring the doctor, see if I can get an appointment for you.
Because once we give them treatment, don't we have?
Well, you should.
Sure.
Yeah. Should I mean the spacer would
That's
have worked for this one, but you didn't have a spacer. So
Yeah,
when
so
it
if you
says
do
no
the
spacer
spacer, then-
available, no spacer available, then to nebulise. So it was a very mild one. She was only 8
Yeah.
and she forgot the puffer and
And
was
she was
stressing.
more worried about maybe it would progress.
Yeah, exactly. So you could say, well, you probably don't need to go to hospital, but it is important that we do follow up. How about I ring your doctor and see if we can get you in there? And but it is important that you, until you get checked and get your puffer,
Yeah.
you stop your workout. You can always come back to it later this afternoon after you've seen the doctor
Yeah.
or something like that. So reassure on that factor.
Yeah.
And then make the phone call and say, well, let's pop you up to your doctor so they can take you now. So does that ever happen? In Victoria? So well done. Yeah, no, I was very happy with that. You covered all your bases. I mean, she was talking 19 to a dozen. It was obvious she was speaking for sentences, but yeah, you didn't verbalise it. That's
Yeah.
not going to be a failure just because you didn't verbalise it.
Yeah.
And you're aware she was responding and everything. I think you actually ticked all the boxes. So
Oh, perfect.
Didn't do pupils.
So it's not trauma, so it's okay.
the heart rate went up
Really?
slightly. Why?
because that could be a side effect.
Exactly.
Oh, I didn't. Oh, there are no contraindications for that in the above indications anyway, so never mind. Okay. But yeah.
So in this subject, we don't have to do disability or environment.
Well, you, yeah, sorry, you last by saying